So Caroline, what do you find challenging on day-to-day basis?
Yeah, anything movement-wise, anything where my feet aren't balanced. So if I've got to do a sort of a lunge, go up the stairs, anything where I don't have both my feet planted and balanced, I feel pain. Sometimes even just getting up out of a chair, I will get pain in the
Groin,
the inner abductors. But yeah, so anything that's like a lunging action, a stepping, a raised step, going up a set of stairs, things like that, definitely cause quite a bit of pain.
All right. So, for example, when you're doing your washing and you've got, you've got a basket of washing to do and you're lunging down to pick it up. So maybe demonstrate what you're finding hard to do and where you're feeling pain or tightness or discomfort.
Yeah. So I would now try to do it with both more of a squatting action, but if I was to do it like this now, I would find it quite difficult with some pain in my knees even.
Yes.
Pain up around here and especially the right side wrapping around here to my hip, and feel quite unstable.
Yeah.
As well.
You are in your third trimester. What are the exercises that you would find challenging to do?
Oh, definitely lunges. They are really difficult at this point and definitely cause me a lot of pain and discomfort, especially in the hip area and the bottom. Just feel I don't have the strength and the balance.
Okay, so let's have a look at your lunge and see what it looks like before we actually put it on the table. So
I'm just trying to do a little one. And often it might be a bit better on one side than the other.
Yeah. So right now, is there any pain anywhere?
Down this, down the
butt cheek?
Yeah, the butt cheek.
On the right side?
On the right side.
Okay, let's swap legs over and see how left leg forward is on your left butt cheek compared to the right.
That's not as bad.
Okay, let's have you do a squat. Just face the TV there and place your hands about here and go into a squat. Just do 5 squats just for you to sort of feel how it feels to go down into your squat. Now, I haven't cued you up to do any pelvic floor or anything like that. You're just going into your squatting as if you're sitting on a chair. And this is what you normally would find difficult to do because it's getting out of a lounge or up and down the chairs and you're finding it hard to do. So notice like just looking at you, I'm seeing your hips are really, really tight. Like you're actually using your hips to get you down there rather than using your glutes.
Yes, that's right.
Yeah. All right, so stay there and just stay in the posture that you are. Take a deep breath in and breathe out. Good. Drop your shoulders down. Lift your rib cage up so your body is nice and elongated. Stay like that. And unlock your knees just slightly. Good. Now lift your pelvic floor muscle up. Just nice and soft. Nothing harsh. And hold it there. Now go into your squat but keeping your pelvic floor muscle contracting. And go into a nice squat. There you go. And come back up. Doesn't that feel a lot better?
Yes, it does.
Good. And now you shouldn't be feeling your hips coming into work.
No.
Keep the pelvic floor contracted. Good. And you can probably even go into deeper squats. So go down now, go down, go down, go down. There you go. And again. And we've got the microphone on the back, so that's not Caroline's bottom. It's actually a microphone. How does that feel?
Yeah, that feels better. Quite a bit of difference.
Beautiful. So after we work on you, then we're going to test these again.
Okay.
Let's get you on the bed.
All right.
So I have Caroline ready on the bed and we're just going to do a little bit of massaging, staying away from the spots that I'm not allowed to touch, like the sacrum. And I'm going to have Caroline just enjoy this. So Caroline, can I have you turn on your back? And we're just going to test the hips. So what I'll do is just really feel where Caroline's hips are and which hip is tighter. So if I take this leg across here, Caroline, bend your knee and take the foot on the outside. I anchor this hip down and just give it a little stretch. Nothing overpowering, not overstretching, nothing. Just have a feel. How does that feel, Caroline?
It feels really nice to have that stretch like that 'cause it feels really tight and locked up otherwise.
Okay, and this is the area that you find is
One of them?
stiffer than the other side.
Yes, it
and
is.
I haven't seen you for a good 6 weeks or something, so you've
Yes.
tightened up a little bit
I
since the
have,
last time.
yeah.
Let's test
Since
this.
the belly's grown the past 6 weeks, definitely things have got much tighter and more locked up.
See, this one's tight as well.
Yeah.
Even though you feel like the other one's tight, this side is just as
Yeah.
tight. All right. So, and you feel like the lower back is pulling on here?
Yes. Even doing that left leg, then I could feel
Yes. All right.
pulling on that on the right,
On the right, around the sacrum area?
around the sacrum.
Okay,
area.
so I'm going to be turning you over on your left side to help you recover, then
Mhm.
do a little bit, and then keep on turning you
Okay.
over.